In today's busy dental practice, dentists can't afford to waste time and interrupt procedures due to setbacks such as patient bleeding. Now, there's a new and improved hemostatic agent that works rapidly and effectively to stop bleeding, so the dentist can complete patient procedures in a timely manner and jump from one treatment to the next without frustrating delays. The Acteon Group, a world leader in advanced dental products, introduces new Hemostasyl, a hemostatic dressing that uses both mechanical and chemical action to quickly stop patient bleeding in a variety of clinical situations. Designed to be used in all cases of moderate bleeding occurring in routine dental practice, Hemostasyl makes procedural delays due to patient bleeding a thing of the past. Hemostasyl is a specially composed chemical paste that provides lasting hemostasis in the oral cavity. The paste is easy to apply and is ideally suited for light to moderate bleeding that may occur from procedures such as scaling, crown preparation, and many other routine dental care procedures. It takes only a few seconds to apply Hemostasyl, and the thixotropic qualities of the paste enable it to adhere to the mucous membrane without applying excessive pressure to the gums, even in cases where there is moderate bleeding. The curved applicators enable precise placement of the paste while preventing the risk of cross-contamination, and after a maximum exposure of 2 minutes, Hemostasyl is easily removed with a gentle water spray accompanied by suction. In most cases, bleeding is stopped within 2 minutes of applying Hemostasyl, creating a clean and dry working area. Quick, safe, and pain-free, Hemostasyl leaves the site free of any bleeding or oozing so the treatment can continue under ideal conditions. Hemostasis is a complex physiological process. In primary hemostasis, the blood platelets aggregate at the source of the bleeding to form a platelet plug. In secondary hemostasis, 13 coagulation factors respond to form fibrin strands, which are dense aggregations of fibers. The platelets and red blood cells become caught in this mesh of fibers, which leads to the formation of a blood clot, so the body can naturally stop the bleeding. Hemostasyl assists both of these natural bodily processes through mechanical and chemical actions. By working together, these mechanical and chemical actions stop light to moderate gingival bleeding and effectively maintain hemostasis throughout the dental procedure. Hemostasyl is a high-viscosity paste that is applied directly to the gingiva with a single-use application tip. Because it is naturally adhesive, Hemostasyl stays on the mucus without compression so that a true dressing is achieved. This true dressing exerts a real mechanical action that stops the bleeding. In addition, Hemostasyl's unique formula of aluminum chloride and kaolin act as an astringent by causing precipitation of proteins on the surface of the tissue. This induces contraction of the soft tissue and blood vessels, which causes the blood to coagulate. The result is highly effective hemostasis that controls capillary bleeding, seepage, and other fluids that might be released through tissue retraction. This hemostasis is further enhanced mechanically by Hemostasyl's thixotropic properties, which allow the material to be placed on the gingiva without pressure, thereby preventing further damage to the tissue. Hemostasyl can be used in a wide variety of clinical applications, including scaling, tooth preparation, impression taking, and restorative dentistry. To apply, open the syringe and screw the single-use angled application tip onto the syringe. Apply the paste directly onto the gingiva at the site of bleeding so that it is completely covered. Do not exert any pressure on the gingiva with the syringe application tip. Leave the Hemostasyl paste in place for 2 minutes and then gently remove the paste from the gums using a water spray with simultaneous aspiration. Make sure that all the paste has been completely removed from the gums. remove and discard the used application tip and tightly close the syringe. Hemostasyl is available in a convenient starter kit containing 2 syringes, 2 grams each, and 40 disposable curved applicators. Each syringe yields approximately 30 applications of fast-acting material, and refill packs for the syringes and application tips may be ordered separately. There are many options for treating light to moderate bleeding in the oral cavity, but none offer all the advantages of Hemostasyl. Hemostasyl can be applied quickly and directly to the gums without using pressure and offers good adhesion to the mucus. It is fast-acting, with a maximum contact time of only 2 minutes, so that dentists can jump from one procedure to the next without delay. Hemostasyl's blue coloration makes it visible in all areas, and the paste is easily removed with a gentle water spray. The paste is easy to handle, and the dressing stays on with no pressure, even in the presence of other fluids. Painless when used on healthy gingiva, Hemostasyl is the fast and effective way to stop gingival bleeding in your patients. Procedural delays due to patient bleeding cost you time and money. Hemostasyl stops light to moderate bleeding in a safe and effective manner so that you can jump from one procedure to the next without delay. For reliable hemostasis in 2 minutes or less, choose new Hemostasyl from the Action Group.